Hello, I'm Shelley Sweeney with the Kansas Office of Veterans Services. Today I want to talk to you about a topic that you've heard something about maybe, but just to give you a little bit of information that might lead you to some benefits and health care that you're eligible for. In 2022, Congress passed a bill called the Pact Act. And that bill expanded access to VA health care as well as a number of new conditions that can be and will be considered VA service-connected conditions. So what is the Pact Act? There was a National Guardsman named Sergeant First Class Heath Robinson, and he was the impetus for this bill. He was a veteran who served after 9/11 and was exposed to chemicals and toxins which caused cancer and ultimately killed him before the VA would recognize that as a service-connected condition. So this bill is named after him, and it has everything to do with being exposed to toxins and radiation, chemicals, things like burn fires, chemicals, things that you might have been exposed to when you were deployed. And even if you weren't deployed sometimes, there are a number of things that might impact your health and it may be service connected. So that's what the Pact Act is for. The very first thing to know is that a number of veterans now are eligible to enroll in VA healthcare where they were not before. The thing to know is that even if you were not deployed, if you were exposed to toxins at any stateside base or post, you may have health conditions that are connected to service, and it immediately makes you eligible for VA healthcare. So the first thing you should do is apply for that, the VA healthcare. So how you do that? Well, you can go online, va.gov. You can apply online, but a really easy way to do it as well is to call a toll-free number and do it over the phone. Get your D214, get your insurance documents, and also your last year's tax return, because some of the questions they'll ask are about that. However, what you need to know is where you served and when you served, and even if it was stateside, what you were exposed to. It could be any number of chemicals and toxins. So here's the number, 877-222-8387. Well, in addition to being eligible now for VA healthcare, so many veterans will be, the more complicated part of that is that many veterans now will be able to apply for service-connected conditions. The things they may have been impacted with in those deployed locations or at home have impacted their health. You won't believe the number of presumed conditions that are in the Pact Act. Things like sinusitis, rhinosinusitis, asthma, that may have been caused by those toxins, skin conditions, sleeping disorders. There are any number of cancers that have been identified as presumed conditions connected to service in those areas. What's a presumed condition? Well, it means if you have the diagnosis of that condition and you served in the location identified as one of those service areas where there were toxins that veterans were exposed to, then the VA presumes those are connected. It's not the same as having to have a record of a line of duty. It is presumed connected to service. So this is important for veterans who may be struggling with health conditions that were not previously recognized as service connected. They may well be now. So then you may ask, well, what do I do about that? How do I apply and find out if those conditions are service connected and if I may be eligible for compensation for those? The Kansas Office of Veterans Services has more than 19 veteran service representatives in the state, but in addition, the VFW, the American Legion, and the DAV all have veteran service representatives and officers in the state. They're all credentialed to help you walk through that process and file that paperwork. And so here's what I'll tell you. All the information you may need to know about how to get in touch with those reps, our office reps, or even just who to call. We also have a toll-free number in Kansas. We're 800-513-7731, but on our website too, you can get right on there, and we are www.ks.gov. In addition, we have 3 veteran service reps that are remote. They're online and they will talk to you virtually. You don't have to necessarily go into their office. So I urge you to get onto our webpage, www.ks.gov, and check it out. Get in touch with the service rep, find out about those benefits and those conditions that you may be struggling with and did not realize they were service connected. Second thing is, go ahead, get it filed for VA healthcare. Go ahead and apply. It's easy to do, and so many more veterans are eligible. It's a wonderful benefit that you earned, all of these things you earned with your service. So I urge you to take a minute when this video is over. I'm going to flip all these things on to the end of it so that you can identify where to go, who to call, what's the number, all of those things. And I want to thank you for serving. Welcome home to all the veterans that have been deployed. And please do not hesitate to contact us and the other folks at VA who can help you get the benefits that you earned. Thank you.